Hi, I'm Kayla Thompson-Riviere, registered nurse and founder of Herd for Life Personal Medical Strategists. What you're about to see is the recording of my pitch competition that I was in recently, and I won. Now, just so you know, this isn't a client-facing presentation. So you're not going to find a ton of information about how I work with my clients. It's actually designed to show the judges both the problem in healthcare today and the solution that we provide, and then kind of pull back the curtain on a little bit of how the business works. But that being said, let's dive in. My name is Kayla Thompson-Riviere. I'm a registered nurse with over a decade of experience, mostly in ER and ICU. There were many times in my bedside career where my direct intervention was the difference between safety and harm occurring to a patient. And I noticed that not everyone nurses the way that I do. And I thought to myself one day, what happens to people who don't have somebody like me on their care team? The answer to that question is why I started Herd for Life. I'd like to make this make a little bit more sense by telling you a real life story. So I'm going to introduce you to a client of mine. We'll call her Sarah. Sarah was living a life she loved in her late 40s, working, caring for her family, and making plans for the future. But suddenly, her world collapsed. She developed debilitating headaches, fatigue so crushing she could barely get out of bed, and blood pressures so low that her doctor said it was a miracle she could even stand. Within months, she couldn't work, she lost the ability to drive, daily routines became nearly impossible, and her world shrank to 4 walls and a bed. Her family watched helplessly. Yet every appointment ended the same way. Another prescription, another referral. Her tests were normal, and her life was anything but. You may think that this is a rare tragedy, but you would be wrong. Sarah's story is devastating, but sadly it's not unique. Many people spend months or even years on this medical merry-go-round. Some pay the ultimate price. In fact, Johns Hopkins estimates that we lose approximately 250,000 Americans every year to preventable medical errors, and over 1 million more are permanently injured by missed or delayed diagnosis. It's an epidemic that doesn't make headlines. It's rarely talked about, sometimes even hidden behind coy phrases like, "These things just happen sometimes." But these are not random accidents. They are preventable failures in a system, a tangled web of overburdened hospitals, siloed specialists, and insurers that prioritize profits over patient outcomes. A web that traps patients in 2 major ways. First is what I call the cycle of chronic illness. When you go to the doctor, you receive some combination of medications, tests, more appointments, and sometimes even surgeries. These generate revenue for the insurers and the providers at all steps, but that does not equal healing. Do not get me wrong, these things can be life-saving measures, but only when used in a coordinated and strategic fashion. Instead, providers are rushed, protocols often drive decisions, and symptoms are treated over investigating root causes. The second force that traps patients is miscommunication. You see, all of these steps tend to happen in isolation. Doctors rarely talk to each other. Patients are left to coordinate their own care, though most people don't even realize that that's their job. They don't typically know how to best explain their situation to their providers, so they bumble through appointments, hoping their doctors will piece it together. We now know that 70% of medical errors are attributed to this miscommunication. That means that medical miscommunication kills more people every year than breast cancer, car accidents, or diabetes. But hardly anybody is talking about it, and even fewer are doing anything. When I learned this, I was angry. I was floored. If 250,000 people died in airplane crashes every year, the FAA would ground flights immediately until the cause was found. And flying is optional. Healthcare is not. Yet this crisis continues unchecked. Herd for Life has one purpose: to drive the number of preventable deaths from medical error as close to 0 as possible. We are rooted in clinical advocacy,
to protect the health, dignity, and lives of our people. We are RN medical strategists who have the training and capacity to see what others miss and the independence to fight for them when the system will not. And in return, we give our clients what the system rarely provides: clarity and direction to escape that path. Now, let's talk about how we make it happen. My restorative care process is the antidote to the cycle of chronic illness. It's composed of 5 steps. First, we assess the full story, discover overlooked connections, strategize a clear plan, put that plan into action with concrete steps, and adjust as things evolve. This is central to all of the work that we do with our clients. A medical roadmap session is our introductory session, and that takes clients through this one full revolution. Our monthly memberships, we go through this month after month. This makes sure that our care stays proactive and not reactive. This is a proprietary method to Heard for Life, but it is rooted in the nursing process, a tried and true method that has been in place for many decades, although now it is largely at the wayside because it requires lots of time and critical thinking. We of course address the second piece as well, which is miscommunication. We close that communication gap with tailored scripts and precise language that clinicians can actually hear. In addition, at the heart of this is my proprietary breadcrumb method, which is built upon these 4 steps here. This gives the patients the power to raise overlooked possibilities without dismissal. At times when needed, we step in directly, speaking that clinical language to the providers. That has benefit to the patients as well, because we're bilingual in our own right, and we can take that complex medical jargon and put it into plain English so that our clients are empowered to make truly informed medical decisions. Now, let me explain how this played out in Sarah's case. About an hour into our initial medical roadmap assessment, she casually mentioned that she would notice a whooshing sound in her ears. Perplexed for a moment, I asked if it matched her heartbeat, and she said yes. Now, this was a turning point in her case, because if her blood pressure were as low as the readings suggested, she shouldn't be able to hear her pulse. Now, this was one of several subtle symptoms that did not match the low blood pressure numbers that everybody had been treating. And it got me thinking, what if her pressures weren't low? What if the readings were actually inaccurate? Then alarm bells went off. You see, Sarah had a history of high blood pressure and had been taking medications to keep it under control for years. But when she suddenly developed these low blood pressures, the doctors took her off those medications. When that didn't help, they put her on medications to raise her blood pressure. And when that didn't fix it either, they doubled the dose. Knowing this symptom chasing could be making her worse if my theory was correct, we went into her next doctor's appointment implementing the breadcrumb method that I discussed. I was able to connect that whooshing sound, explain the mismatch between the blood pressure and the symptoms, present my theory that perhaps we were looking at a blood vessel issue, and questioned if it could be connected to her autoimmune history. That changed the lens of everything that they were looking through, and ultimately changed what we were pursuing. She got a very specialized CAT scan that showed she had an incredibly rare and aggressive autoimmune condition that would be fatal if left untreated. I can say confidently this was on nobody's radar screen and would not have been caught without this kind of intervention. And those medications that to raise her low blood pressure, they were making her situation critically endangered because her blood pressures were actually sky high. This is the power of our model. The restorative care process uncovers clues that have been buried, and the breadcrumb method turns those clues into action. Within less than 2 weeks, she went from bedbound to having a diagnosis and a treatment in place. For decades, patients have thought that if their doctors can't connect the dots, they are out of options, bouncing from provider to provider with their fingers crossed. Heard for Life ends that cycle and gives patients a voice and a path to answers. Now you may be thinking, Kayla, this sounds really nice, but is there actually a market here? I'll be honest, I worked with the SBDC and the Rommel Center for Entrepreneurship, and nailing down a total addressable market is very tricky, which makes sense because my clients, like Sarah, fall into what I call the medical misfits. They are the undiagnosed, misdiagnosed, and dismissed, and they fall outside of typical categories. But here is what we do know. 12 million Americans every year suffer from diagnostic errors. Now, of course, not all of them are a candidate for our services. But if we segment out for those who are proactive about their health, which is about 10%, and have the resources for out-of-pocket expenses, further narrowing 10%, that leaves us with a segment of about 120,000 individuals. When we apply these same filters to those affected with rare diseases, that brings us to 420,000 potential clients. But the need goes further still. While looking at my own client base, half of my clients actually do have a diagnosis, but are still caught in medical complexity and need the strategy that we provide. Applying this logic to the broader market, our potential client base now doubles to 840,000 individuals. When you also factor in the untold number of undiagnosed individuals invisible in the data, this number has to be close to 1 million people. Now, a moment ago, I mentioned that one of those filtering criteria is those resource enough for out-of-pocket expenses. Trying to determine who those people are is not as simple as looking at their household income, because when life is on the line, people find a way. I have worked with clients on Medicaid, Social Security, and school teachers that I never thought it would be in their budget, but it was. That being said, I never want finances to be a barrier to care. So in July, I actually established a scholarship fund and intend to work with nonprofits to grow that, to make sure that we can provide sliding scale coverage in a way that is sustainable for the business. So as that grows, the number of potential clients will continue to grow as well. And the timing of this is urgent. From now until 2030, we will have 10,000 Americans a day turning 65. So by 2030, that'll be 1 in 5 Americans at retirement age. We know that this population uses far more healthcare resources than the younger population. This will collide at the same time that we are experiencing healthcare shortages across the nation. By that year, we are looking at a projected shortage of over 100,000 healthcare workers and 124,000 physicians. So skyrocketing demand is going to meet shrinking capacity. When demand outpaces supply, healthcare will become a battle for resources. I say will become, it already is. It's just going to get worse. Fortunately, this is a situation where the squeaky wheel gets the grease. The problem is that most families do not know how to push effectively. That is where advocacy comes into play. So it is no surprise then that the global advocacy market is expected to nearly double from 2023 to 2030 to almost 7 billion. And with America being the largest consumer of healthcare in the world, it is safe to say the opportunity there is enormous. But let's talk about competition. So when we're talking about healthcare navigation, there is essentially 2 categories. First is system-based navigators. These are people employed by the hospital or paid by the insurers. Because of their allegiance to the system, meaning follow the dollar, there are significant limitations for what they can actually do for an individual. A lot of my clients have found that out firsthand, and that is why they have moved away from that. Because of that, I do not see these as true competitors. However, the second category is independent advocates, which is technically the industry that I fall under. However, it's important to note that about half of these providers do not have a clinical background. They do important work in emotional support and logistics, but do not have the expertise to bring the strategy that Heard for Life does. Furthermore, even those with clinical experience, that does not necessarily translate into medical strategy. Heard for Life is different because we have leveraged that clinical experience to create a structured, repeatable framework that combines clinical depth, proven process, and communication mastery. This is our true competitive moat. We make sure that no detail is missed and no client goes unprepared with any healthcare interaction. This is what changes client outcomes and truly sets us apart. In the world of independent advocacy, the industry norm is for services to be billed by the hour, typically $100 to $200 an hour, but up to $500. I personally found that creates hesitation for families, unknown hours and unknown final bills. In crisis, that uncertainty becomes a barrier to getting the help that they truly need. That is why, since March, Herd for Life has switched to a flat fee and membership model to create predictable cost. This is what that looks like. Everybody starts with our medical roadmap. That's our deep dive session that goes one full revolution around the restorative care cycle. Judges, inside your folder is the medical roadmap plan that I created for Sarah. That is yours to keep. Feel free to look at it at some other point in time. Now, from the medical roadmap, most clients do continue with ongoing services so that we can go through that process month after month and update their strategy as things evolve. They have two options. We offer a continuity plan, which does that structured strategy session plus guidance in between. They also have the option for a la carte services. That way they are never without a lifeline. That investment is $297 per month. For those who want execution taken fully off of their plate and coordinating the doctors, conducting the research and chart reviews, and even handling those painful insurance calls, we have the medical master plan, and that investment is $997 per month. At that point, all they have to do is show up. This model removes financial uncertainty for the clients and creates predictable recurring revenue for us. And it has worked well since I have switched to this model. At this point, the bulk of my leads are warm referrals, and about 50% convert into the medical roadmap. From there, about 80% stay with us and move into a long-term membership. Our average relationship is about 6 months, which generates an average lifetime value, client value of nearly $5,000. With my operating expenses being around $3,000 a month, I have been breaking even since May, however, deferring to pay myself in order to reinvest in growth of the business. Scaling is relatively straightforward because the unit economics are strong. My services are built on an effective hourly rate of $165. This means that I can afford to pay registered nurses above fair market value and still leave very healthy margins for growing the business. My break-even point once I bring a nurse on board will be 26 billable hours a month, which is only 6 to 7 clients, not too far from where I am right now. One strategist will be able to serve about 20 families per month, which means once I get up to 3, we will be serving more than 100 families annually. Recruiting is not a barrier. There are millions of nurses, and a lot of them seeking meaningful employment outside of hospitals. I already have several previous colleagues interested and have conducted my first interview. However, I am nearing my own capacity and only able to take on 1 or 2 more clients while still running the business. That's why this competition comes at a great time, because fueling growth is becoming quite important. If I am awarded, the money will go to 2 purposes. First, I know it says number 2, but first is that team expansion I was just referring to. That will allow me to hire and train the next RN strategist so that I can fully step into my CEO role without stalling growth or sacrificing quality. Next is marketing and awareness. At this point, as I mentioned, growth has been organic, but I am ready for a megaphone. As you can see, we have a lot of people to help. Just this week, I have launched my new podcast, Scripts and Referrals, to already begin building trust. In the future, I am working towards building an AI tool trained with our proprietary communication techniques like the breadcrumb method to put these tools in the hands of families far beyond what our services will be able to provide. Just imagine the amount of lives we can impact with that. Now you may be wondering, what happened to Sarah? Sarah got her diagnosis, but it came too late, and we were not able to stop her disease. This is the reality when the system delays and dismisses patients. Sarah's story is why we exist, because for every family that runs out of time, countless others don't have to. We know that early intervention changes the trajectory of people's lives. But our biggest challenge is awareness. When your sink is leaking, you know to call a plumber. But when you're caught in the medical merry-go-round, most people don't even know there's a way to get off. That's why this funding is so critical. Heard for Life ensures that families know where to turn and gives them answers and strategies that can save lives. We exist to drive the number of deaths from preventable medical errors as close to zero as possible. This is not just a company mission statement. It's my soul's purpose. And with your support, we can make it a reality. Thank you.